So at which point of time, probably we can think of sending the patient home. At that point of time, we need a company who can provide these equipments at a cost on a higher basis, because these equipments are expensive. A patient or a family would not like to really buy all those equipments, invest, and then afterwards they may not need it. So if there is a company which can hire them on a weekly basis or a monthly basis, and if there is a company which can send their expert, like a respiratory therapist or a nurse, to the house of the patient, they would look at the patient every day, and they would be in constant touch with the treating doctor about the parameters, about how the devices are working, how the ventilators are working, what changes need to be done. So they would work on a checklist model. So they will go through a checklist of 15 to 20 things, and then they would brief the doctor with the help of the WhatsApp or SMS or dedicated software, and the doctor would keep constantly advising them. And the care would continue, let us say, for another week or 10 days or maybe 2 weeks, and the patient would get better. So he would save a lot of money. From 60,000 rupees a day, the entire cost of the care would come to something like 2,000 rupees a day, which is a huge saving. So now we are working on a model with some of the device companies who are the market leaders in the country, with them. So a few patients will start doing, see how it is going, what are the difficulties, and then improve on that model and make it a commercial model. These barriers, in fact, from my mind, have already overcome, because we already have a sizable number of patients who are asking, sir, we are at the end of our resources. Is there any way that we can go home so that you can send somebody to take care of the patient and the gadgets can be hired? So that demand has already been building up over a long period, the last, say, 10 years or so. The demand has been building up. Only thing is, there was no player in the market who could fill in the gap and then do all those things. So that void is now going to be bridged now. And as far as the patient feeling comfortable in the hospital, they purely go by the word of the doctor who has been treating the patient. They develop immense confidence and faith in the doctor, because this doctor who has been with the patient for the last 4 days or 5 days, and the patient who was very sick and now has got better, and if he is advising that this is the next best for you to go ahead, they would definitely follow. It will benefit every hospital, but the only thing is, the stumbling block, as you rightly said, the barrier, is in the mind of the doctor. The doctor has to decide that this is the right time for him to send the patient home. He has to have the courage to shift the patient from hospital care to home care. And that courage would come from knowledge, and the knowledge would come from experience. So the more experienced, the more knowledgeable doctor would send the patient sooner to the home care, and the less courageous, less knowledgeable doctor probably would like to feel safe by keeping the patient in the hospital. For every innovation in healthcare, there has to be a leader. So that's the reason why we are doing this hospital to home care model on 10 patients, and we would publish the benefits and the pitfalls in doing this model. And once this model is a successful model and it is published for everybody to read and see, that would give the courage for other doctors to go for more home care. So all things have started like this, and then today it has become sort of a way of life. Yes, it will be, because we have already seen in the last, say, 25 years or so, home care has been a big thing in the United States. Insurance companies are supporting the home care. In the United States, doing sleep studies in the sleep labs. To construct a sleep lab is very expensive. To do a sleep test in the sleep lab is very expensive. Now the insurance said we are not going to reimburse a sleep study which has been done in the sleep lab. We will reimburse a sleep study if it is done in the house of the patient. So the paradigm shift is taking place from the labs to the home evaluation, home studies. And home care is a big thing. A lot of respiratory therapists, physiotherapists go visit the patient at home and provide the service. Insurance finds it easy to reimburse this because it is less expensive. Providing the same services in the hospital is very expensive because of the infrastructure. Here in the home, there is no infrastructure. It is just the device, the patient, and the healthcare provider.